I wonder if part of the reason for that increase in cost is that the penalty that is there, not being able to take the income tax, the personal exemption on your income taxes. There are folks, healthy young folks particularly, who have said it's going to cost me less to lose that exemption than it is to pay for health care. And when that happens, your risk pool ends up being much more significant. The people who are buying it are less healthy. The risk isn't spread out amongst the whole pool.
Absolutely.
How do you change that? How do you get more people or different people into the system to lower costs?
Well, there's the problem with trying to do this on a state level is that the cost is so driven by Medicare and Medicaid. In a lot, in the poor, in the lower income population, that's in that high risk pool, and in the senior citizens, which are also in the high risk pool. Without federal involvement on those two issues, it's really hard to get costs under control because people get to make a decision. They get to decide, well, do I take a hit here? Businesses who have 10 or 11 people get to decide, well, I'm not going to pay for it. I'll just pay $2.95 a person, and it'll save me. Probably cost them $500-600 a month before that per person to pay for it anyway per month. So there's not enough of a disincentive. There's not enough of an incentive to be covered for those who think they're invincible and can survive without health care. And then, of course, if, God forbid, something were to happen to them, they would end up in the free care pool, and it would end up ratcheting up the costs overall again. But until you get... Once again, Massachusetts has led the way and given some great direction to the country as to how we can make something like this work. We're also bearing the burden of the problems of it. But I believe that if we get a Democratic president and an increased majority in the House and the Senate, we'll be looking toward a national program. And I know my good friend and mentor Ted Kennedy is working right now on what a bill would look like when President Obama hopefully takes office, and we have Democratic leadership in the House and the Senate. So they're already working on trying to fix that, because we can't fully fix the issue here in Massachusetts without controlling the major cost factors of Medicare and Medicaid.
Let's take just a minute to see if we have any questions from the audience before we move on. So we have a question for Representative.
You felt, as far as the healthcare goes, towards when people say age 22, 23, and they're out of college, it's not a good job field right now. So that cribbing together a couple of jobs, painting houses in summer or plowing in winter, do you think that the healthcare initiative should extend to them, or do you think,
well, I think
they're just cribbing together part-time jobs, but not through no fault of their own, that they are not fully employed?
Yeah, no, I think it extends to everybody in Massachusetts. Yeah.
You're in favor of that?
Yes. I'm in favor of everyone in the United States and the world having health care coverage, because if we all have it, it leads to a massive reduction in health care costs over time. Because, when I was a selectman, between my first year and second year, our health care premiums went up 50% in 1 year, and it became a huge budget issue for us. But if everyone in the country or in the state were insured, more people are getting preventative care, more people are dealing with primary care issues, and less things end up being emergency room care, which is a lot more costly, or critical care issues, which are a lot more costly. So yes, I'm for folks in that job market and that age group being covered, because they may think that them not being covered is better for them, but in the end, as a society, it's better for all of us that everybody get covered, because if we get the preventative care, if everybody gets preventative care from early on in life, number one, you'll live longer and live happier and healthier, and you will also reduce the cost of health care across the board, which reduces the cost of doing business, reduces property tax burden, reduces everything.
We have a question from Bob Bloom, who's the chairman of the Sterling Democratic Town Committee. Mr. Chairman?
Mr. Kerrigan, what differentiates you from Harold Martin and your candidacy here?
I will say this. My campaign has not been directed on me versus anybody else. My campaign has been about my breadth of experience in all levels of government and what I can bring to work in the State House each and every day. I have a passion and commitment and dedication to doing this job 100% if I were elected. And I think that's what our government needs. Our government needs more people who are focused 100% on doing the job day in and day out, focused only on that, and that's what I have. But my campaign is not about anybody other than me and the skills and the experience that I have to bring to the campaign and to the State House. Thank you.
Just a quick follow-up on that, and I don't want to put you on the spot here, but you must see some contrasts between yourself and Representative Naughton. I mean, if there weren't any areas of contrast, then it would be difficult for you to run, I would think.
Well, it's difficult for anybody to run for office. It's not easy. You have to make a lot of sacrifices. You have to take a lot of time away from your family and from other things and other ventures. I believe that I have what it takes to do this job each day, 100%. I'm committed to the job. I want to do it full time. I want to focus all my attention on it. You can draw your own conclusions, do whatever you'd like with that. But this job is too often in government, folks downgrade the importance of responsibilities given to people. When you're elected, I don't care what the office is, elected or appointed to a public office, it's a public trust. People are putting their lives in some measure in your hands. And if you don't take that deadly seriously, then you shouldn't be serving in office. And I do take that seriously. And I get frustrated when people out there say, oh, well, it's just the State House. What's the big deal? The big deal is that the state legislature passes the $28 billion budget. They drive into town and they cast their votes, and they work hard to make our communities and our state as a whole better, or at least they should. Too often people look down on those jobs, and people end up believing that impression, and I think that's wrong. And I'm committed to doing the job 100% and want to work each and every day from the day I'm elected to the day I leave office.